Welcome to episode 8 of Ask CPS. My name is Janine Chatelier and I will be your host for this season. On today's segment, we have 3 epidemiologists. We have Eva Lister-Weaver, Dr. Sana Van Kampen, and Dr. Lee Bowman. Today, we would be discussing some questions that would give us some insight on the current situation of COVID-19 on the island of St. Martin. Today, we will ask Eva Lister-Weaver, what does CPS do? How do they do what they do?
Sure. So for COVID-19 response, CPS essentially takes all calls that are coming to the helpline, so the 914 helpline, and we also conduct testing. So my nurses go in the field conducting testing on persons who are suspected of having COVID infection. We also do source and contact tracing, which is done by a field of nurses as well. And we monitor persons who are either confirmed cases or those in quarantine.
Can you tell us more about the hotline, how to contact? Can you give us more information on that?
Sure. So the 914 hotline is functional at CPS between the hours of 8 a.m. to 8 p.m. There's no cost actually for the caller. So if you do have any questions around COVID, please use that as an avenue to contact us directly. Or if you suspect that you do have COVID infection, we also ask that you call your physician. And if you're unable for whatever reason to get a hold of 914, your physician will call us at CPS to follow up with you.
What can you tell us concerning the local outbreak?
Great question. So essentially what we're seeing now in this wave is vastly different from the first wave. So there has been, unfortunately, an increase in cases over the past few weeks. Actually, starting on July 1st, we started seeing an uptake of cases. At the moment, we are currently monitoring 232 active cases, which means those persons who are actively in isolation and their contacts who are in quarantine. So there are local outbreaks across a number of venues that we're seeing all over the islands and in different sectors. So in the beginning, it was primarily focused around evening activities. So you would see clusters in casinos, in nightclubs, and now what we're starting to see are clusters happening in places of work. So this isn't to create panic, but just to let you know that we are seeing local transmission on a broader net than we did in the first wave. And when we say clusters, what we mean are cases that are linked to each other. And what we do at CPS is we follow up on all cases and contacts of these clusters as fast as we can. Now, in terms of the age demographic, what we saw in the first wave was primarily older persons. And right now, what we're seeing is that on St. Martin, half of the persons that are infected now in this wave are between the ages of 20 to 40 years old. So we absolutely recommend social distancing in all parts of society, but especially for those persons in that age bracket that I mentioned. What I will say on a positive note is that in this wave, we are seeing higher rates of recovery and lower hospitalizations and deaths. So knock on wood, because we are seeing sort of a younger demographic, I'm hoping that we can keep our hospitalizations low. So that's, I want to end on a high note, because while COVID is serious and we are sort of asking persons to continue to practice those public health measures of social distancing, wearing a mask, we can only keep those numbers low if you do your part as well.
You're watching Ask CPS. Please stay tuned.
The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Good day, General Public of St. Martin. I'm Dr. Felix Holliday, General Surgeon and Medical Director of the St. Martin Medical Center. I'm staying at work for you, so please stay home for me. Stay safe.
My name is Christina Jacobs-Burkle. I'm the Junior Patient Care Manager. COVID-19 affects everyone, so please, everyone, let's protect everyone and stay home.
Hi, I'm Meandra Hazel, ICU nurse. I'm a frontline nurse and I'm asking you to be a frontline citizen. Please stay home, save a life. Help me to help you.
This public service announcement is brought to you by the St. Martin Medical Center and the government of St. Martin.
Safety tips on how to use your mask. Wear your mask in public places. When removing your mask, properly take your mask off by grabbing the bottom ties of your mask, then the ties at the top, and remove the mask. When disposing the mask, discard the mask in the trash can and do not litter. Safety first. Don't touch your eyes, nose, or mouth until washing your hands thoroughly for 20 seconds. These safety tips are brought to you by Collective Prevention Services and the Department of Communication.
St. Martin has experienced its fair share of hurricanes over the past 25 years, and we faced them all head on. We've witnessed horrific seasons with staggering loss of property, but this year might be the most destructive of all. The destructive power of hurricanes coupled with the debilitating coronavirus pandemic. Where do you run? Where can you hide? Now is the time to prepare. Think about how and where you'll evacuate to reduce crowds at shelters and maintain social distancing. Have a plan for keeping your elderly family members safe. We live in a hurricane-prone area, so start gathering essential hurricane supplies now. Things like plywood, batteries, generators. Strengthen your home as much as possible while you have time on your hands. While preparing for the hurricane season, follow the latest health guidelines at stmartingov.org/coronavirus. And remember, it only takes one to make it a bad season, so make sure you're prepared.
This public service announcement is brought to you by the government of St. Martin.
Welcome back to Ask CPS. We're here with Sana. Sana, if a person has any symptoms of COVID-19, what should they do?
Thanks for that question. If you have any symptoms of COVID-19, we ask you to call your GP or call the CPS hotline at 914 as soon as possible. So the most common symptoms of COVID are cough, shortness of breath or difficulty breathing, fever or chills, muscle or body aches, vomiting or diarrhea, and a new loss of taste or smell. So if you have any of these symptoms, please call 914. And I want to remember people that the hotline 914 is for people with COVID symptoms. If you have a medical emergency, please call 911 instead. I also want to let people know the hotline is available, open for calls from 8 in the morning until 8 in the evening. So after these hours, please contact your GP instead. So on the hotline, if you are found to have any symptoms, CPS will be able to schedule you in for a test for COVID-19.
Sana, concerning testing, when should a person consider to have a COVID-19 test done?
Yes, so like I said, if you experience any symptoms of COVID-19, we ask you to call the hotline and get a test. So at the moment, yes, we are only testing asymptomatic people. If you are not displaying any symptoms of COVID, you are deemed to have a low risk. You're at low risk to yourself and to spreading the virus in the community. That's why we're only testing people with symptoms. And I can explain a bit more about the testing procedures. So if you're scheduled in for a test by CPS, a nurse will take a swab from your nose. The sample will be sent to the laboratory where a PCR test is conducted. And this test will pick up the genetic material of the virus. So CPS will call you back with the results within 1 to 3 days. And if the test is positive, it means that you currently have COVID-19. And you will be asked to self-quarantine for 14 days. If your test is negative, but you do have symptoms, you are still asked to self-quarantine for 14 days as a precaution for the rest of the community. Thank you.
Thank you, Sana. You're watching Ask CPS. Please stay tuned.
The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Good day, St. Martin. My name is Emiko Birdlake, cardiologist here at St. Martin Medical Center. We are now in a medical crisis and we need you to help save lives. So we're asking you to please stay at home, bond with each other. Please help us save all the lives possible. Stay at home.
Hi, I'm Nurse Moni Gomes, a registered nurse at the St. Martin Medical Center. I am here to tell you all, remember the number 1 step, wash your hands, and number 2, stay at home.
This public service announcement is brought to you by the St. Martin Medical Center and the government of St. Martin.
El COVID-19 se puede transmitir de persona a persona. Por eso, para mantenerse seguro, hay que conservar una distancia de por lo menos 2 metros o 6 pies de otra persona. No besos, no abrazos y no dar la mano. Este mensaje lo trae el Servicio de Prevención de la Comunidad.
Welcome back to Ask CPS. We're here with Dr. Bowman. Dr. Bowman, what advice do you have for persons with suspected or confirmed COVID-19?
Thanks very much, Janine. The first thing I'd like to say is to reassure the general public that most infections of COVID-19 only present with mild symptoms. So it's highly likely you're going to just develop mild symptoms with this illness. So not to panic and not to worry. The second important factor is to note that you will be required to quarantine for 14 days. That's whether you're a case or a contact. So that's 14-day quarantine at your home, no exceptions. Then you will need to notify your GP that you've been requested to quarantine by CPS, and then also speak to your GP about any prescription medication that you'll require throughout that 2-week period. Please also, of course, notify your employer that you cannot return to work for that duration. Now, in terms of what you might do at home, you can find a room where you can isolate if possible, if you have the space. But there are some general social distancing and hygiene measures that you can undertake to help protect your family. And that is firstly wearing a mask in your home. Also increasing the cleaning of surfaces, particularly in the restroom, because we know that COVID-19 can survive for a few hours on surfaces. So use a bleach solution to clean those down. Perhaps also get your family to prepare meals so you're not in the kitchen as regularly as you would otherwise be. Of course, practice safe hand hygiene, so washing your hands regularly with water and soap. Where that's not possible, use an alcohol gel. Importantly, don't share any linen, don't share your towels, don't share your utensils. So have a collection of things for you and your exclusive use. So that's some of the guidance that we can provide for people quarantining in their home. Whilst that quarantine period is moving forward, you will receive a call from a nurse regularly. So once every couple of days, a CPS nurse will call you to discuss how you're feeling, how your symptoms are, and any other concerns that you might want to discuss. We might also do a spot check. So that's to turn up at your door and also see how you're getting on. So don't worry about things like that. Finally, as you come towards the end of the quarantine period, the nurse will again be in touch with you to notify whether or not you can be released from your quarantine period. And as soon as you receive that release, you should notify your physician that the 14-day quarantine period has ended. So generally, remember to wash your hands, keep your distance, and wear a mask.
Thank you, Dr. Bowman. Another question. What advice would you give to the local business community who has an employee who is COVID positive?
Thanks, Janine. Okay, so I just want to firstly reassure businesses that CPS is working really hard to identify both contacts and cases across the island, and particularly at workplaces, to ensure that the virus does not spread widely and rapidly. So in general, people can continue to go to work if they do not have any symptoms and there are adequate precautions being taken in the workplace. So you can wear your mask, keep your distance, and wash your hands. However, I'd also like to remind employers that if there is a suspected or confirmed case at your workplace, that you do not need to shut down the workplace. We will be in touch with the case and any contacts, and both the case and the contacts will be quarantined to ensure that there's no onward transmission within your place of work. I'd also like to say that anyone, of course, who does have symptoms should call 914 and not go to work. But also I'd like to say to employers that there's generally no international evidence in support of fumigation of workplaces. So there's no evidence to show at present that fumigation will reduce transmission of COVID-19. The practices that we do know that work are washing your hands, keeping your distance, and wearing a mask. So that is absolutely essential in the workplace. So generally, I'd like to say that please, employers, work with us to keep both your employees safe and your employees in work.
Thank you, Dr. Bowman. Is there any additional information that you would like, or any other points that you would like to reiterate?
Yeah, so thanks for this. I would like to say, generally, there is firstly no need to panic and no need to worry if you are infected with COVID-19. Yes, there is transmission across the community, but CPS is working hard to conduct our source and contact tracing. So we'll be in touch with those people that we need to be in touch with. And if you are requested to quarantine, please do so for the full duration of the 14 days. That is absolutely crucial if we're going to get a handle on transmission across the island. The second series of bullet points, let's say, that we could walk through would be firstly to keep 6 feet or 2 meters apart when speaking to people or general members of the public outside your home. Wear your mask when outside in the general public, so in places of work, in shops, grocery stores. If you need to sneeze or cough, make sure that you cough or sneeze into a tissue, throw that tissue in the bin, and then wash your hands afterwards. If you don't have a tissue, a cough or sneeze into your elbow instead. That's also effective. Generally, wash your hands with soap and water where available, and if soap and water is not available, use an alcohol gel. That is also effective against COVID-19. Wipe your surfaces down regularly, both in the home and at the workplace. Use a bleach-based solution, and that will kill the virus on contact. Stay at home if you have any symptoms. This is absolutely crucial if we're going to reduce transmission on the island. You must stay at home if you have symptoms. And of course, do not go to work if you have symptoms, otherwise there's a danger that you will spread it to your work colleagues. And finally, if a member of your household is symptomatic and confirmed positive, please ensure that the whole household also quarantines. CPS will be in touch with you with further details, but keep all members of your household at home. Finally, wash your hands, keep your distance, and wear a mask. And if you have any questions, please get in touch with us using the email address askcps@stmartingov.org.
Thank you, Dr. Bowman, for that wealth of information. Communauté haïtienne. Bonjour, bonsoir. S'il vous plaît, si vous avez aucune autre information sur COVID-19 là, relez 914. Si vous avez des symptômes ou sentez malade ou tousser, relez 914 avec relais docteur Caillou. S'il vous plaît, continuez laver main, nettoyez si face que vous servez facile. Mettez masque, restez 6 pieds ou bien 10 mètres le parler avec l'autre monde. Continuez prendre tout effort pour pas gagner COVID-19 ça. Thank you for watching. This brings us to the end of Ask CPS. My name is Janine Chatelier.